Hello everyone. Today we'll be talking about burnout syndrome. So basically when we talk about burnout, it refers to a state of emotional, physical and mental exhaustion that's caused by excessive and prolonged stress. So there are three components to this: emotional, physical and mental exhaustion. What causes it? Excessive and prolonged stress. Okay, so this occurs when you feel overwhelmed, emotionally drained and unable to meet constant demands. As the stress continues, you begin to lose the interest and motivation that led you to take on a certain role in the first place. So, burnout is defined in ICD 11 as follows. So, ICD is basically International Classification of Diseases. So, burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. So, it is characterized by three dimensions: feelings of energy depletion or exhaustion, increased mental distance from one's job or feelings of negativism or cynicism related to one's job, and reduced professional efficacy. So, burnout refers specifically to phenomena in the occupational context and it should not be applied to describe experiences in other areas of life. So, when we talk about burnout, we are specifically referring to occupation, okay? So, it's in the context of occupation, not any other aspect of life, okay? So, signs and symptoms of burnout include, so if we look at it, most of us will have days when we feel helpless, overloaded, or unappreciated. If you feel like this most of the time, however, you may be burnt out. So, burnout is a gradual process. It doesn't happen overnight, but it can creep up on you. So, the signs and symptoms are subtle at first but become worse as time goes on. So, you can think of the early symptoms as red flags that something is wrong that needs to be addressed. So, if you pay attention and actively reduce your stress, you can prevent a major breakdown. However, if you ignore them, you'll eventually burn out. So, basically, in the brain, you may notice some red flags that something is wrong. So, if you address it, you may avoid the burnout. However, if you do not address it, then you might have a major breakdown. Okay. So, what are the physical signs and symptoms of burnout? Feeling tired and drained most of the time, low immunity, frequent illnesses, frequent headaches or muscle pain, change in appetite or sleep habits. Emotional signs and symptoms of burnout include sense of failure and self doubt, feeling helpless, trapped, and defeated, detachment, feeling alone in the world, loss of motivation, increasingly cynical and negative outlook, decreased satisfaction and sense of accomplishment. Behavioral signs and symptoms of burnout include withdrawing from responsibilities, isolating yourself from others, procrastinating or taking longer to get things done, using food, drugs, or alcohol to cope, taking out your frustration on others, skipping work or coming in late and leaving early. So sometimes how can you like differentiate, am I just stressed or is it burnout? So if it's stressed, it's characterized by over engagement. Burnout is characterized by disengagement. In stress, emotions are overreactive. In burnout, emotions are blunted. Stress produces urgency and hyperactivity. Burnout produces helplessness and hopelessness. In stress, there's loss of energy. In burnout, there's loss of motivation, ideas, and hope. In stress, you may get anxiety disorders. In burnout, it may lead to detachment and depression. In stress, primary damage is physical, and in burnout, primary damage is emotional. And stress may kill you prematurely, burnout may make life seem not worth living. So, what are the causes of burnout? Burnout often stems from your job, but it's not caused solely by stressful work or too many responsibilities. And there are other factors that contribute to burnout, including your lifestyle and personality traits. In fact, what you do in your downtime and how you look at the world can play just as big of a role in causing overwhelming stress as work or home demands. So, how do you deal with burnout? Dealing with burnout requires the 3R approach. So, what are the 3Rs? Recognize, reverse, and resilience. So, recognize, you need to watch for the warning signs of burnout. Remember, we talked about the red flags? Reverse, you undo the damage by seeking support and managing the stress. So this is whereby we try to address our problems, okay? Then resilience. That's where you build your resilience to stress by taking care of your physical and emotional health. So that's all about burnout syndrome. Thank you.